Good afternoon or good morning, depending upon where you're watching us from, and welcome to the Minority Health Summit here presented on blackdoctor.org. And so you might be asking yourself, why am I here watching a Minority Health Summit on a Saturday? A Saturday where the weather is starting to get a little bit better, a Saturday where we could be having, doing some honeydew lists and running some errands around the house and getting some things done that we can't get done during a week. And my response to you is you can't afford not to. Because what we're going to be doing today is we're going to be talking about some really important health topics that could and should save a life. So the Minority Health Summit is April is Minority Health Month, and today's the last day of April. And so we're really going to dive into some really important topics for you and your family. So I would say to you that sit down, bring out a pencil and pad, take some notes, and really enjoy some learning about you and your health. And so the day is we're going to start with colorectal cancer panel that's presented with our partners at Cedars Sinai Hospital. Then we're going to move into diabetes. We're going to be talking about clinical trials and why it's important to participate in clinical trials. We're going to be talking about how to prolong your life through healthy eating. And we're also going to be talking about how to overcome infertility. All those subjects and more are going to be broached today. So have your questions ready for our panel specialists. So I know you did not sign on today to hear me talk. You're here to talk, to learn about your health. So let's start with the first panel. Now, the question is, we're talking about colorectal cancer today, is because did you know that Black men and women are 20% more likely to be diagnosed with colorectal cancer than their white counterparts? And for the Latinx community here in the US, colorectal cancer is the second most common and fatal cancer in this population. So that doesn't shake you up enough to show why you should be watching this program. I don't know what will. So let's introduce our panelists. Our first panelist is Dr. Ronald Hurst. He is a surgical oncologist, got to say that 5 times real fast, at Cedars Sinai Hospital in Marina del Rey. And we also have Dr. David Padua, and he's an MD PhD. Wow, that's a lot of school. And he is a gastroenterologist also at Cedars Sinai. And then we have Kalan Goins, and he is a Cedars Sinai employee who will share his experience with a colorectal cancer screening. So we're going to get our guests here. There's Dr. Hurst. So welcome to the program, gentlemen. Looking forward to this discussion. So we got a lot to talk about today, so let's go ahead and get started. First question is, we know that colorectal cancer is more common in Black and Latinx community. Can you discuss why that is? I'll throw that out to the doctors. Can you help us understand why it's more prevalent in our communities?
Sure. I think it's a very layered process, Ellis, and it's not one component that contributes to the statistic that you gave early. Most important is to keep in mind that colorectal cancer is pretty prevalent in the United States. And in 2022, our projected number of colorectal cancers across the entire population, about 151,000. 52,000 of those will die from colon cancer, and that's 34%. So just that alone is significant. So when you peel that first layer back and you say, okay, now let's look at our African-American population and Latinx. What the most important thing is that when we look at them stage per stage, when they're diagnosed in this subset of community, they're diagnosed with more advanced disease and often at an earlier age when you compare it to our white counterparts. So then we peel back that next layer and ask the question, why is that? Well, obviously there's a small component of genetics that plays a part, which helps understand why they get diagnosed, earlier. But then you talk about access to health care. When they have limited access to health care or fear of getting screened, right, because of the unknown or uncomfortability of getting a colonoscopy or getting a rectal exam or taking a stool test, right, they shy away from doing that. And when that happens, they end up being presented with more advanced cancers at that time just because of inability to go get it done and have access to it. So when you look at all those different layers, not one component contributes to that glaring statistic that you mentioned at the top of this storyline here. All of those play a part. So I'm hoping today we can sort of one by one address those issues and how we can make an impact today with our collective efforts.
Yeah, absolutely. I just want to echo what Dr. Hirsch said. I think it's really important for all of us to understand that the risk of colon cancer affects, the broad breadth of American society, and it's important to know that colon cancer, screening is really the key to preventing colon cancer deaths, and every community needs to be involved in getting the word out and getting their colons screened. The research behind it, and it actually is a big push nowadays to try to understand how we get different populations to be screened at what should be 80%. That's the goal for Americans now, is to get 80% Americans screened. And at the moment, we're falling short of that goal in every demographic. We're about 60 to 70%. And so really what we want to do, especially with programs like this, which I think is a great opportunity to get the word out, is get people the information they need to get themselves healthy and get screened.
Absolutely. So I guess the next question would be, what are, and this is the big one, please explain what polyps are and how they become cancerous in the colon or rectum, and why they always need to be removed if found.
Well, that's a very important question, and understand that. And a lot of that is related to who we are. You heard this statement that we are what we eat. Well, when we look at certain foods that we eat, there's carcinogens, or these are things that cause cancer in the intestinal tract. Well, what happens is when food does not move normally in a normal transit time every day, food remains stagnant in certain places in the colon. And that allows the carcinogens or cancer-causing entities in our diet that are preservatives that cause injury to the inner lining of our colon. When that happens, it causes an abnormal growth we call polyps. And these polyps can shed and bleed and leave DNA into the colon that we can detect with screening. But without them being noticed, these polyps begin to grow. And as they grow, if they're not diagnosed before, they can turn into cancers. So that's the importance of screening, because we can pick those polyps up early. And when we identify them, you remove them, because once you remove them, you can actually prevent someone from actually getting cancer. So it's so important to understand that polyps can develop based upon the things that we eat. And if we start in our lifetime, starting with a more balanced diet that with fruits and vegetables and more exercise in our diet, we can prevent some of these entities from happening. So that's the most important thing I could tell you about regarding polyps.
Well, that's good to know. That is absolutely good to know. So, Dr. David, a question for you. Is this mainly a men's disease? It kind of just feels like, we talk about it in terms of a masculine, kind of being a more masculine disease. What risk, if any, is there to women and colon cancer?
That's a great question, because the risk is fairly similar. It's about 1 in 22 patients, male patients will develop colorectal cancer in their lifetime, and it's 1 in 25 female patients will develop colon cancer. So it's relatively similar. It's slightly more prevalent in men, but definitely an issue that females have to address also. And I just know from my own personal experience doing colonoscopies and doing colon cancer screenings, I can think of the handful of patients that I've diagnosed with colon cancer in the last several months. It's been an even split between the two of them. So it's really important for both men and women to make sure that they get their colon cancer screening done.
Dr. Hirsch, you mentioned diet before. I want to come back to that. What are some of the things that we can do diet-wise in order to lower our risk of colorectal cancer?
Very good question, which this is where the rubber hits the road. Diet is based upon good fruits and vegetable intake and high fiber intake. And the reason why that is because both fruit and vegetables have high fiber intake. And what that allows is a normal day-to-day transit time. And I'm sure Dr. Padua will agree with that. If we keep the bowel moving with our normal daily bowel habits, then that leaves less chance per day from any preservatives like salts, red meats, preservatives used to preserve our foods in the United States, as well as charbroiled food. Those are all carcinogenic potentials. So if you leave those stagnant in the colon, like I alluded to earlier, that will one's risk much higher for developing injury to the inline, the colon, and generating polyps and subsequently generating cancers. So diet is very important, that we need to start a good balanced diet with fruits and vegetables every day in our diet to maintain a normal good transit of our stool through our colon.
Absolutely. So for those of you that maybe didn't study as hard like me, carcinogenic means cancer causing. So want to also ask a question. There's a question about screening. And I know it's been talked about recently. There's a recommendation that was moved from 45 to 50. Should we follow that recommendation? Should it be earlier? How, and there was a question from the comments that said, how often should we be getting screened?
Yeah, that's a great question. So the previous guidelines were Americans should get screened at age 50 and above, and that was recently changed to 45 and above. The guidelines had always been for African Americans to be screened at 45 because of the increased risk of colon cancer in the African American population. So the guidelines have now shifted so that everybody now is at 45. And the reason for that is that, we're seeing this trend in younger patients developing colon cancer. And the goal from the American Cancer Association and the different societies that we have is to try to prevent these as much as possible. So screening earlier is going to be really important. The unfortunate case of Chadwick Boseman, I think, really crystallized that point, where you see this sort of vibrant young actor, really, a leader in his field, and someone that all of us looked up to, come down with something serious like this. And I think it really set the tone and made everyone understand that this is something that can affect anybody, and it's really important to go and get the colon cancer screening done earlier. What's happening is that the rates of colon cancer have been fortunately dropping in patients that are above the age of 65 because of aggressive screenings like we're doing. But in the age population between 45 and 55, we're starting to see a slight uptick in colon cancer among that group, about 2% in the last several years. So that's an important population to target. And I'm really glad that we're having this conversation, because people don't know that at age 45 is really the time that you should start thinking about getting your colon screened. And earlier, if you have a family history of colon cancer. That's another component that I think is important to stress, that if your family members have had a history of colon cancer, then you should be getting your colon screened a little bit earlier, at age 40 or even earlier. So it's best to talk to your doctor about getting your colon cancer screening information.
Dr. Yes, go ahead.
I was going to comment something with what David said, which I think was really remarkable. When you talk about, African American and being diagnosed much earlier, how we start screening earlier, and we talk about Chadwick Boseman, I'm a little older than David. So when we go back a little ways, we think about Darryl Strawberry. Darryl Strawberry was in his 30s, in his 30s, and that was 20 years plus ago. That this process, this genetic evolution of early advanced colon cancers in African American men and women, started decades ago. And that question has led to where we are today because of stories like that. And that is early diagnosis at age 30 and dying from that is so significant. And that started 20 years ago. So we're working through this process, and we're making some advances here. And hope that this summit will continue to push us forward.
No, you're bringing up an excellent point. I forgot Darryl Strawberry was my favorite baseball player when I was growing up. I remember that was huge. Let's bring in Kalan. Kalan, you had kind of a life-changing experience with the screening. You want to share your experience? Because I know we're talking about getting screened, right? We're talking about the age of when we get screened. We're talking about things that can affect our body's ability to maybe start formulating polyps and all these things. So let's talk about what that screening experience was like for you, and what made you get screened?
So I started I guess I started out with, like a lot of men do, with the association with colorectal cancer, with it just being one of those anomalies that, it probably won't happen to me. And I was just probably wrapped up in my own sense of immortality. And I remember the summer of 2020, we were in the midst of the pandemic. We were all at home watching TV. And I remember working, and I remember getting the text message on, I think it was from CNN or one of the news channels that I follow, saying that Chadwick Boseman died. So I flipped on the television, and, it was all over the place. And I just remember Googling and seeing that Chadman was, right around the same age as me. So when Chadwick died, that really kind of really opened up a whole new range of thoughts in my head around getting screened. And so I said to myself, if it can happen to this guy, it could definitely happen to me. Of course, us being in the middle of the pandemic, I don't think I was really as aggressive with trying to get screened at that point. And then went through a couple other of life-changing things that happened over the next few months. But you fast forward to earlier this year, and I joined one of our groups at Cedars that was really advocating for the additional screenings for in colorectal cancer. It was our colorectal champions program, where we were going out and advocating for employees to go out and get screened. And me working in HR, that's part of my function, is really to advocate for the wellness, health and wellness of our, employees. So what really prompted me to do that was really to put myself in their shoes and really come from a place of experience to be able to talk them through the process and really talk them through, how simple it is to really go out and really participate in the fit test, which we'll talk about a little bit later. But that whole process of going through the fit test, it's something that is less invasive than the traditional process that we're used to, but it's something that I definitely appreciated because it made the experience a lot more easier for me.
So, all right. So you cracked the door. You cracked it open. So I'm gonna open it up. I will open it up for you, Dr. David. They are Kalon's mentioning fit tests, and we got to find out what that is. But what are some other ways that we can kind of do some pre-screening before we go and get that? Because I think a lot of people get frozen up when they say, I got to go get a colonoscopy, right? And you hear that and everybody goes, oh no, like especially with men. I'm going to say I was one of those men too that kind of said, oh, hey, wait, what?
Right.
But what are some things that people can do pre-screening, even like if they don't have a family history, if they don't have any of those other kind of early markers, but what can we be doing?
Yeah, so that's a great question because screening comes in a lot of different flavors. So the best test is always the test that you get. So it doesn't have to be a colonoscopy as long as you get some form of screening. So there's two forms that I basically advocate for my patients. One is colonoscopy. I think that is the gold standard screening test, and that's where we do a procedure and look with a camera and take out any polyps if there are any. The second test is the non-invasive one that we're talking about. It's called the FIT test, right? So that's basically the fecal immunohistochemical test. And so what happens when you come to a clinic or when you go to your primary care doctor is you get a little envelope. And in the envelope, you have basically a little information card that you have here that you fill out with your information. And you are given a little kit that helps you go to the bathroom, right? So what you end up going to get is you have to collect the stool. And so we can talk a little bit about how to do that because there's a little bit of mystery of what happens when you're doing that. So the easiest way of doing that is you are given a stool hat, which is basically a little tiny bucket that you can put in the toilet seat, and you do your business in there. So that way you can actually collect the stool. And there's several different kits that are out there. I'll show you two of them. One of them is going to be using these little brushes. So you basically brush the stool, and then on the stool, you're given a card. This card is going to be the test that you send in. So you open up the card, and then you have two little spots. So you take each of the brushes and put two different samples on these spots. You seal it up. You're given a sanitary bag to put it in, and then ultimately you put it in an envelope and then mail it to your doctor's office or the testing site where they do it. The other option is basically you're given a little tiny probe that you basically, again, sample the stool, put it back in the little tiny kit, put it into a little biohazard bag, and then back into the envelope that's been sent to you. So those are the two styles of fit kits. Basically, the non-invasive stool test that you can have your primary doctor or your GI doctor order for you and be able to get that sent out. And that basically is a great screening tool that's very effective to screen for colon cancer. If it's positive, that's when we have to start talking about doing a colonoscopy afterwards.
Okay, so you just made me feel a whole lot better about that fit kit. I'm not even gonna lie, because I had all of these ideas in my head. I didn't know it was a stool cap. It was like, I'm reaching into the stool. But then I had this thought, and the other thought is, I have a dog, right? And while I walk my dog, you got to pick up when they leave their pile, you got to pick it up. And so if I'm not squeamish about picking up my dogs every day, then I shouldn't be squeamish about something that's going to impact my health. And so I think that's the kind of the mindset that I got around. But now you're talking about brushing and poking. I can do that all day long. So Dr. Hurst, when you're talking to people like me, might be a little squeamish about those fit kits, what do you say to them if they say, "Hey, I don't want to do a fit kit. It's too much for them." What do you say to them, to those people that say they don't want to do the fit kit?
Well, I try to be very straightforward and very simple. I just ask a simple question. Do you want to see tomorrow? Do you want to wake up and see the next day? What are all the things that you live for from day to day outside of yourself? If you have loved ones, if you have family, coworkers, something that makes you get up every day, I think those are reasons enough just to do a minimally non-invasive test to give you a chance to wake up the next day and have a chance. Because without being proactive in your care, then you lose the opportunity. You give that power away. At this point, you have the power. So stay in control of your lives. And I give them that simple speech every time, whether it's colon cancer or any other cancer that I manage. I tell them the exact same thing. Don't be afraid of the things that's going to give you a chance to see the next day.
Well, yeah, that's a great answer. There's a couple of questions coming from the comments. I'm going to throw these in there because when we're talking about diet, and this has come up in other discussions that we've had here on Black Doctor. And if you're just joining us, we're talking to Dr. Hurst and Dr. David and Kalan about colorectal cancer. So, but the question is, what about a cleansing, right? And people know that there's these products that they can buy from the local drugstore. They say, I can just do a cleansing. They can go to GNC, take a couple pills, do a cleansing. How effective are those cleansings? And do you recommend them as kind of a preventative measure for against colorectal cancer?
I'm going to let David take this question, and then I'm going to give my biased comment after he's done.
Yeah, no, I get that question a lot. People often come to me and say, yeah, I want to do a colonic, or I just want to clean everything out and just kind of take all the toxins out. And there's no data to suggest that that's going to basically reduce your risk for colon cancer or reduce your risk for polyps or really any medical issues, right? And what I often tell patients is that cleanse that you're doing every 3 months, every 4 months, that's not really affecting the bottom line. What you really got to do is you got to be going to the bathroom every day. And we talked a little bit earlier about eating vegetables, having a plant-based diet or more plant-based diet, some fiber in your diet to really get things moving down there so that every day you're having a regular bowel movement. It's really about the consistent daily evacuation of everything so that things don't stay static inside your colon.
Dr. Hurst?
Yes, okay. It's a real pet peeve of mine because people have a tendency to eat poorly and then let me cleanse when I want to. Well, that's not how it works. Okay. And also, when you do that, and David will echo this, you potentially alter other systems in your body, that you affect your electrolytes in your body, which can affect your kidneys. And then you got other problems because you become dehydrated and it changes your bowel patterns. And then patients have oscillate between constipation and diarrhea. And David can talk all day about that. And those are all other problems that then David and I will have to deal with as a consequence of doing a colonic cleansing to try to prevent something it will not prevent. So I'm off my soapbox. I'm done.
No, we need to know that. That's definitely because I know they always sell those, and they give it primarily to like pregnant women and things like that. That little orange liquid that you drink and it blows you out. But if that's not what we should be doing, we should be doing the kit. So all right, so let's go back to the kits. Dr. David showed us a great example, so I feel much better about the kit. So I'm cool on the kit. So Dr. Hurst, what happens if I send my result, I send it in and my results come back positive?
Okay. I think first message to convey to everyone out there is that if the kit is positive, it doesn't mean you have colon cancer.
Okay.
And I think that's the real message to resonate into the community today.
Yes. Say that again one time for the people in the back. Say that.
Just because your kit till it's positive, it does not mean you have cancer.
Okay.
So you don't have to run away from it, run to it, so you can figure out what is wrong and see if it's real or not. And if it's positive, you need to see doctors like Dr. Padua, and you need to get a colonoscopy, as is the gold standard screening test. And that will determine if you have cancer or not. That is very simply stated. That's all you need to do with the positive kit test. Take a breath. I don't have cancer. Let me prove that I don't. That's the way you look at it.
And do we know how long it takes for the results to get back from the fit kit? Kalon,
David,
how long did it take your?
Mine were back in about 72 hours.
Okay.
Yeah, I would say I usually tell patients about a week or so to get the results back.
Okay.
I just want to echo what Dr. Hirsch said. I think that's really, really important what he said about just because the positive fit test comes back doesn't mean that there's no hope or that all is lost and you just don't do anything. It's really important that that's when you act. The most of the fit tests, are there to screen, and most, are important to help you understand what the next steps are. And really the important thing is to get a colonoscopy and evaluate what the risk is. Oftentimes I don't find a colon cancer per se, but I find a polyp that over time could develop into colon cancer. So you've really nipped it in the bud by catching it super early to make it an easy procedure to eliminate your risk for colon cancer in the future. So really, really great that Dr. Hirsch mentioned that. And I think it's a really important point.
Okay. So how often? So let's say I do my kit, I send it in, my results come back negative. When do I do another kit?
Yeah, so fit tests are designed to be done every year. So once a year, your primary doctor, your GI doctor can send you a kit, you mail it in, and you're good to go.
Okay. So Kalon, let's talk about, let's bring kind of that, as a Black man who knows the importance of screening. How do we get more of us to get screened? Like this point blank period. Like, how do we get more Black men to step up? And so we can close that gap that I mentioned at the top of the program. How do we get more Black men to get screened early enough to where it gets caught and we can do some more effective treatments versus later on down the line where it's just the outcomes are not as robust?
Right. I think that there's just a lot of psychological layers, to being a Black man, and coping with this, with this disease and this ailment. I think the first thing is realizing the fact and being truthful about the fact that there is something somewhat emasculating about a diagnosis that you can't control. As African-American men, we're raised to be the leaders in our family. We're raised to be the leaders in our community and in the workplace. And so when we're put in a position where we feel like we couldn't even control or lead our own bodies, there's something that kind of is, emasculating and kind of diminishing in that realm. So it's kind of just, kind of changing the perspective around that. The first thing is also, having conversations that about this topic, in the places that we frequent, whether it's, in our barbershops, in our churches, or just out in the community in general, just being very open and transparent about talking about this disease so that it brings an awareness to it like we have with other diseases such as like diabetes and HIV and things like that. But it's also balancing things that we have, within the African-American culture. Sometimes, we talk about things in spaces or things that can be perceived as, toxic masculinity, or, even religion can even cross the barriers of, thinking that prayer can fix everything. And while those things are important, it's important to also realize that you need to be the champion of your own health, like Dr. Hirsch said earlier.
You said a word right there. Do you need to be the champion of your own health? Absolutely right. So now that you're making some wonderful points in terms of how we need to start having these conversations, and not just here on blackdoctor.org. We love you coming here and watching these wonderful programs, but we need to have those conversations with our friends and family. We need to make having health related conversations part of things that we do, where we're on the golf course or we're in the, wherever we are. We need to start having some health related conversations and not just make it kind of that taboo. And you don't find out about somebody's health condition until they catch something or until they get diagnosed with something. And that's when typically we find out. And then it might be a little bit too late. So definitely need to normalize those conversations. So Dr. Hurst, I may have to ask you to pull your soapbox back out. What do we say to those people that are still saying, no, I don't want to get screened. I'm not even going to get the fit kit. If it happens to me, it happens. What do we say to those friends or family members that just say, you know what, I'm going to let the chips fall where they may?
Well, that's a profound question that requires a profound answer that we don't have the answer to. Honestly, we don't. And I think we have to be realistic about that, but we can't quit. We have to remain persistent in encouraging our African-American men and Latinx men and women to be just true champions, like Kalon said, for our healthcare. Now, I spent many years in the community doing events going to the same places you just talked about, Kalon, barbershops, churches, free symposiums, bringing experts to talk about colon rectal cancer, bringing it to them. And what I statistically found was 90% of the participants were women. Women who are real champions for their healthcare. Okay. And they pushed. So I had to try, how can I get the men there? So I asked all the women to bring their men. Okay. My next event, I said, bring your cousins, bring your nephews, bring your husband's friends, and then bring some food. Okay. So I try everything out there to get the men to show up. So that number went from about 10% representation for men to about 35% representation for men.
Okay.
Then I said, how can I make it better? So I had to start bringing athletes, people who can advocate, that they just want to come see, just to get them there. Because once they're there, they'll get the information. They become empowered and they become knowledgeable about the importance of being champions for their healthcare. Because we've seen that in the Black Men for Prostate programs that have done very well, because they brought them disease to them and kind of dispel these fears. So I think it's important that we continue to press and press and press to get the men of color, both Latinx and African-American men, to come to these events so they can become empowered and take away all the fears. Because once they're there, they ask all the right questions, and hopefully we give them all the right answers. And then they become more encouraged to do this.
Absolutely. It's funny, as you were saying that, we had a comment, I put it on screen, and it says, it said to get more Black men screened, get more Black women screened. Education is the key. And so we will follow it. And we always, it's kind of it's not really a joke. It's the running kind of truthism that we have here at Black Doctor, is that, women are the chief health officers of their families. And so if we can get them to come in and say, oh, okay, well, bring your husband, bring your uncle, bring your brother, bring your son, bring them with you. I think that's a great approach, so they can get that information. Because sometimes, we know some things get lost in translation. When you say it to somebody, then you say it to the next person. It's like that telephone game, right? And so we'd like to get the information from the source, directly from the doctors. And so, all right, so Dr. David, if someone has never been screened and they're still waiting for their kit, what are some signs that they can see on their own that could be a warning sign to maybe there's something going on in their colon?
Yeah, it's a great question. I think first and foremost, screening is by definition, you don't have any signs. So it's really important not to wait for the signs to come up, but really get screened at the appropriate intervals, starting at age 45, like we talked about, or if you have a colon cancer history in the family at age 40. But really the things that my patients come to me that perk my ear up and make me concerned are if you have rectal bleeding, right? If you have a change in your bowel habits, if you have a lot more diarrhea versus a lot more constipation, if you have weight loss, if you're feeling fatigued, or if your lab work shows that you have some anemia as well, some low blood counts or hemoglobin is low. Those are all signs to me that tell me that there might be something going on the inside that we definitely have to get checked out. And by checking out, that involves getting a colonoscopy. At that point, I think the FIT test is not the right test, but the colonoscopy would be the best and safest way to move forward.
Absolutely. Well, yeah. So I was going through the checklist of mine. Okay, all right. So you said anemia. We said some change in stool in terms of whether it's diarrhea or constipation. Um, some bleeding. Is that bleeding over several days, or because I mean, and what's the? I guess the question is like, what's the difference between like a hemorrhoid and a polyp, or something that could be more serious?
Yeah, that's a great question. I get that a lot in clinic. It's hard to tell. That's why it's important when you have those signs to make sure to talk to your doctor about it. And I've had patients that have, bleeding every day for 3 years, and then they come in and there's something on the inside that we have to address. And I've had other patients where the bleeding is not that common, but they still have something serious on the inside. So when you do have those signs of bleeding, it's really important to come in because it's, not every patient has the same experience. So it's always a good, important thing to have it checked out.
Okay. All right. You convinced me. I'm getting there. I'm getting there. I'm going to start reaching out for my fit kit. I promise you. I'm going to get one, and I'm going to get the seat cap. Now I know there's a seat cap. I'm getting the seat cap. All right, Kalad, what are your last thoughts? What are your thoughts when you hear that and you hear what Dr. Hurst is talking about? You hear what are your overall thoughts? And when we're talking about screenings, understanding that screenings have to come before you start having any symptoms, right? The screening is just to say, okay, I'm not feeling any symptoms, but let's just see, because that blood in the stool might not show up significantly. If I'm hearing you correctly, Dr. David, it might not show up significantly enough to where you don't notice it. And then when you do notice it, you could be, it could be further along. So what are your thoughts? Let's get some feedback from you as a Black man sitting here watching this.
I think what really frightened me and what really kind of pushed me to do the fit test was the fact that if you have symptoms, you are probably in late stage at that point. So I definitely wanted to, advocate for myself. And I think it's all about, thinking about, as a Black man, all the things that you touch in your life. Do you have a spouse or significant other? Do you take care of elderly parents? Do you have children? These are all things that we touch that would be impacted if you were to die. And for me, myself, I take care of my mother, who is back east. And, I have a family that I try to help to support back east as well. So I just wanted to make sure that I was here and I was doing the right things. And I think that has to be your why. Your why has to really resonate with everything that you touch in life, and what you impact, and how they would be impacted if you were to leave.
Right. So, Dr. Hurst, as a surgeon, I hear this a lot of times from other surgeons I've talked to. They say, when you come see me, it's not a good thing. So how do we get people to not come see you? I don't want to put you out of business. I understand it's your job, but how do we slow some of your business down?
Well, it's what we've been saying this morning, resonating with screening, like Dr. Padua saying, seeing doctors like Dr. Padua, your primary doctor, to be proactive in your care. Get your annual screening with the fit kit. That'll keep you ahead of the game. If you have symptoms, don't wait. Get a hold of Dr. Padua or similar doctors. Get your colonoscopy. When you get to the right age, get your colonoscopies, because even in the best setting, some people are going to still have diagnosis of cancer, and they're going to still have to come see doctors like me. And if you end up seeing me in my office, you want to be in a position where you're in the earliest stage of your presentation, because now you have multiple options for surgical treatments that can be minimally invasive, short hospitalizations, less pain, small incisions, and patients can be cured after these operations, and they can have a normal life. So again, even if you do get a diagnosis and you have to come to see someone like myself, you want to be in the best state and earliest diagnosis for that to have the best outcome.
Dr. Padua?
Yeah, absolutely. Getting the polyps early, getting them taken out before they develop into colon cancer is really the best way to have a long and healthy life. And I want to echo what Dr. Hurst said. If you get it done early, the surgeries are, if you need a surgery, and most patients don't, but if you do need a surgery, it's so much easier when it's a localized small lesion that you detected early on. It makes his job a lot easier, and it makes the patient's job recovering that much better.
Absolutely. Okay, so there was a question earlier in the program from our audience, and I'm going to put this on screen because if I try to say this word, I might end up tripping all over it. But is diverticulosis a reason for a difference in frequency of colonoscopy?
Yeah, so diverticulosis is not shouldn't change the frequency for getting a colonoscopy. Diverticulosis is it's a word that just means that the colon has little tiny outpouchings, little tiny pockets that form, and that can happen for genetics, for diet, and people with a long-standing history of constipation can get slightly more of these little tiny pockets that form. There's nothing inherently dangerous about the little pockets, and shouldn't change your frequency of colonoscopy.
Okay. All right. So in recapping, what we have learned today is that there's a gap between Black and Latinx communities and their white counterparts in terms of the amount of colorectal cancer. We know there's a myriad of reasons as to why that gap is. Some of those things that are in our control, and those things that are in our control are diet, right? How much, what we eat, what we put in our body. So we're going to reduce some of those carcinogens that we put in our bodies. We need to eat more fiber. There was a question earlier about drinking water. Drinking more water, because that probably could help that getting more regular. Try to be regular. Move your bowels every day. There is a kind of a understanding, watching your body, watching what's going on, feeling those symptoms that are not, getting that fit test, right? There's Dr. Padua gave us a couple of examples of fit tests that are making, and that made me feel so much better, because I really thought I was going to have to reach in and grab something, but that's not a good thing. But getting those fit tests will that could be like that first line, that you go into, and then getting your lab work, checking your screenings. Have some questions that you ask your doctor. You say, hey, look, notice when something is different, right? Notice when something is different in your stool. Notice when something is different in terms of how often, the type, the softness, whatever. Those type of things could be markers. And if we ignore them, it can lead to a bigger problem. And then ultimately, get that colonoscopy. Right. So we can do all the fit tests if you want to, but if it comes back positive, we know you got to go in and get that colonoscopy to be sure, because as both doctors have said today, does not mean a positive fit test does not mean that you have cancer. It's just a positive fit test. That means you go get checked and get that colonoscopy. And we're moving that time up. And that's I think that's another key thing that came out today, is that moving that time up. That 45 age of 45 is a line of demarcation. Now, if there's some factors that could move that even up further, and that like family history and things whatnot. I'm going to throw a kind of like a question out. What role does genetic testing play at all in this? Should people start thinking about getting genetically tested early in life to see if they're predisposed to something like Chadwick Boseman got it in his 30s, and there's been we talked about Darryl Strawberry earlier. He got it in his 30s. Will genetic testing help at all in this process?
Genetic testing is a good option if there's a family history of colon cancer. If you have an uncle and a brother and 8 cousins that all had colon cancer, then I think it's really important to have the conversation with a genetic counselor, and your doctor can refer you to someone like that about getting genetic testing. The challenge with colon cancer is that there's a lot of different genes that are at play, so we don't have all the answers. We only have a few specific tests for a very small minority of patients that can develop genetic abnormalities that lead to colon cancers. But the vast majority of the times, these are genes that we don't know of yet, and we don't have screening tools available. So it's really important to know your family history, ask your uncles and your parents about their history and whether they've had a history of colon cancer.
Okay. How much fiber and water?
I like to echo.
Go ahead.
I want to echo what David said, because many people want to get genetic tests as, let me just get it to make sure I don't have it. It doesn't work that way. Okay. It just doesn't work that way. So they just can't go out and get a genetic test, because there's so many genetic DNA mutations within the colon, and we don't know the significance of those yet. So we wouldn't even know how to manage a lot of them. So it's only when you have a significant family history, then we can make a direct clinical correlation based upon genetic results and what we can recommend for them. So Dave is 100% right.
I feel like we're getting funneled right down to the same destination, and that destination is get your fit test, get your colonoscopy, and eat better. Like those three things seem to be coming back. So speaking of eating better, how much fiber and water should an adult person in their 40s aim to, eat each day? Is there kind of a certain amount that we should be eating each day?
I mean, what I tell my patients, it's really challenging because there's so many, everyone's different, right? So it's hard to know what the right level is for you versus somebody else. And just because you drink a certain amount of water doesn't mean that you're going to get the perfect bowel movement every day. So what I often counsel my patients are, how often are you going to the bathroom? So you really want to shoot for once a day, or once every other day, twice a day. There's kind of a range, but really that should be your goal. And using, hydration is really key. It's really important to make sure that you drink enough water to sustain that level of bowel movements, and to go to the bathroom, go urinate, a few times a day, and make sure it's not that dark, cloudy urine. That means that you're dehydrated. So making sure that you have, I know this is getting a little detailed here, but this is a conversation that I have with my patients almost every day, making sure that you have clear urine, and that and then if you need some help going to the bathroom, if you're a little bit more on the constipated side, or if you're a little bit more on the loose side, fiber supplementation I think is really key. I take Metamucil, I take fiber supplements every day because I think it's really helpful for me, and I advocate it for all my patients.
Yeah, I want to add that we didn't talk about this, and that in addition to eating well, exercise is a very important part to our health and cancer, because a lot of cancers are immunologically based cancers. It means they're dependent on the immune system. And if the less we exercise, the less we eat healthy, our immune system is not fed and nourished enough. And we need to bolster our immune system, and exercise could do that. And I think adding a daily exercise program with a normal, healthy diet regimen all can contribute to better outcomes with regards to stool function, cancer risks, cancer prevention, because immune system plays a vital part in fighting off infections as well as preventing some cancers.
So there's a question about sleep. Like what role does sleep play in terms of helping you stay healthy? Because I know that's also something that comes into play when we're talking about stress, reducing your stress, eating right, exercising, and getting enough rest. So I think for an adult, it's about 6 to 8 hours, if I'm correct. Am I correct on that?
Yeah, there's actually a study just came out recently that as you get older, that magic number, it's always been 7 to 9 hours.
Okay.
And now the best number is 7 hours of sleep. 7 hours of good sleep, and you cannot catch up. So you can't go over the weekend and say, I'm gonna get 12 hours sleep. It is 7 hours of sleep every night, which helps you. It helps the immune system. It reduces stress. It gives you a complete balance. So sleep plays to this multi-layered process that we talked about at the top of the hour. That all of these components play a part, and it's not just one thing that helps us get us far away from a diagnosis of cancer.
I think that's the most disappointing part, is that it's not just one thing that I could just do or not do. It's all of these things put together, and it starts with the things that we have the most control over, right? As an end user. So doctors say all the time, they tell us all the time, you got to eat better, you got to exercise, and we just say that's part of the kind of the repetitive things that you all say. That's what the doctor's supposed to say, but we don't realize, and what we're realizing more and more is that what they're saying is true. What they're saying will keep you from seeing them. The other reality is this: doctors only see you less than maybe 30 minutes in a year if you're only going for your annual checkup, So the rest of that time, your health is, as what Kalan was saying earlier, your health is driven by you. It's driven by what you eat every day. It's driven by what you do or don't do every day. And that is whether you choose to exercise, you don't choose exercise. If you choose to take the stairs or you get on the elevator, if you got a bike that's getting dust in your garage, all of those things you are controlling. So when you go see your doctor and your doctor says, hey, your numbers aren't really good, that's your fault, not the doctor's fault. And so we have to recognize that. So all right, that's my soapbox. See, Dr. Hurst, you got me with you pulling out my soapbox. So I'm gonna put it away. And ask if any final thoughts. So we'll start with Kalan. Any final thoughts since we are wrapping up here?
Sure. I guess I would just leave with the fact that, be a champion for yourself. Consider the implications of every decision that you make every day around your health. For me, like I said earlier, it was really about making sure that I could have a long and healthy life and be supportive of my family as they get older and take care of them. But everybody's going to have a different reason why. But also, I would say, support each other. If you're a woman on this call and you have men in your life, definitely talk to them and have conversations about their health and advocate for them. Bring it to the table, even if it is uncomfortable. Help them schedule those appointments and help them follow through with their care. And if you're a man on this call, do the same thing for the women in your life as well. It's really important that we really advocate each other and support each other. I know that within our community, there's a lot of distrust around healthcare, just based upon some historic things that have happened. We look at Henrietta Lacks, we look at the Tuskegee Airmen and things like that, and there's a lot of controversy around the vaccines, with COVID and everything like that. But I think it's just really important that we really trust the fact that that this is the best avenue to really advocate for yourself and be a champion for your own health.
Dr. Padua.
Yeah, I just think that's a great point, to really be an advocate for yourself. And I also want to just make sure that everyone understands that there's a lot of taboo with this part of the body. People don't like to talk about it. They think it's icky and gross. I've been asked everything under the book, so I love when a patient comes in and says, I'm really embarrassed to ask this question, but I've always wanted to know. I love that question because that means that I'm able to enlighten them on something that they've been curious about and could potentially help them out. And so please feel free to ask your doctors all the things that you're on. There's no taboo topics. I talk about this day in and day out. It's very, very easy and very important to talk about this stuff because you do it every day.
Absolutely. Or you should. Dr. Hurst.
Well, finally, I think David and Kalan said it all. And the thing to really resonate is that you do not live on an island. We live in a community. It takes a village to survive within your own home and your next door neighbors and your community, your workplace. Everywhere you step out, we're in a village, and we need to encourage each other. And it's important to encourage each other with the facts, not theories, not conspiracy theorists. We want facts because we don't want to confuse. We want to enlighten. And if we're going to be in these communities, in the churches, in the barbershops, and workplace, let's just talk about the facts and empower each other with the truths. And then have that be our wisdom and direct us to do all things that are right so that we can, again, see the next day.
Wow. I don't know how to wrap this up after all of that. Thank you all. Thank you, Dr. Hurst, Dr. Padua, Kalan, for sharing your story. We told you, hey, look, we kicked it off. We kicked it off right with Minority Health Summit. We got more panels today, but this was the right one to start the day off with. Colorectal cancer is not something that we talk about. And that's why we called this one, Let's Get to the Bottom of Colorectal Cancer, because we need to get to the bottom of this. We need to understand that colonoscopies save lives. So that's got to be part of your screening. That's got to be part of your health regimen, eating right, exercising, getting enough rest, and protecting your mental health. Lowering those stress levels will go a long way in preventing this. And if you do there's some great people at Cedars Sinai. So we want to thank our partners at Cedars Sinai for helping us put this together and bringing us some wonderful, wonderful guests. There's going to be some information in the comments on how to get your fit kit. So there's 2 out there that you can go get, and they're very, very simple to use. Make sure you get your cap, though. You got to get the cap to sit on top of the toilet. Got to get that cap. But understand this, that the more you know, the more that you can share. So like and share this program, share it with your friends and family. It's being broadcast in Spanish on our Daily Vitamina page. And so we're trying to cover a broad range of people, but share this with your friends and family and let them know that there is some life-saving information as part of this program. So thank you all again for joining us. Thank you, audience, for being here. Thank you for the wonderful questions. I may have some wonderful questions coming in from the audience. So I'm just so happy to be there. So stick around. At the top of the hour, we're going to be talking about the unseen consequences of diabetes. And so that is going to be an interesting discussion as part of our Minority Health Summit. So thank you all and thank you for joining us today.